Hello, I'm Dr. Suraj. I'm a psychiatrist practicing in Mumbai. Today, I'm here to discuss about some common myths surrounding psychiatric medications. You all must have heard about it, and we have heard about it plenty of time. So, I'm here to clear some of the myths surrounding psychiatric medications. Myth number one is that psychiatric medications are to be taken lifelong. हम सब ऐसे सुनते हैं कि आपको एक बार अगर साइकेट्रिक दवाई चालू हुआ तो आपको ये ज़िंदगी भर चलेगा. I want to break this myth that this is not the case. The medications are required for a fixed amount of time. Once you are better, you and the doctor make a combined decision of gradually reducing the doses or stopping the medications. Myth number two, psychiatric medications are harmful. So this is a very common concern amongst all of the patients as well as their relatives that ये medicine लेने से kidney, liver या बाकी organs पर damage हो सकता है. Be rest assured that most of the medications are completely safe and can be given in a wide range of population. Your doctor and you will be able to understand the side effects and manage the doses. Myth number 3 is that psychiatric medications can change your personality. Ideally, if you do not take the medicine and you are suffering from a psychiatric disorder, you are more likely to change. You'll be irritable, depressed, not sleeping. Medications will in fact help you feel better and will help you to function better. Myth number 4, psychiatric medications are not required or they are just a crutch. Many a times हम हमेशा सुनते हैं relatives को बोलते हुए that you do not need these medicines, you can just come out of it or think strongly or think positively. But whoever patient suffers from this, they have tried all the other techniques and then they decide to come to a psychiatrist. जैसे डायबिटीज़ में इंसुलिन या इन्फेक्शंस में एंटीबायोटिक्स की ज़रूरत होती है, उसी प्रकार से इन अ साइकेट्रिक डिसऑर्डर सर्टेन मेडिकेशंस आर रिक्वायर्ड for treatment. Another myth which we commonly see is that psychiatric medications are overprescribed. So this is a very common myth that people feel that if they go to a psychiatrist, they will be prescribed medications. This is not the case. The psychiatrist and you together discuss about your symptoms, your severity, and the course of your illness, as well as the duration from when you are suffering. Whether the illness affects your functioning, your day-to-day life, your sleep and appetite. These are certain factors to be considered when starting psychiatric medications. If the doctor feels that you do not require medication, he might probably not even start you on a medication. So this myth which people have that psychiatric medications are always prescribed is not true. Another thing which we commonly see is that people feel that psychiatric medications are a last resort. So before things go south or you suffer a lot, the psychiatric medications as well as therapy and lifestyle modifications go hand in hand. Your doctor as well as your therapist can decide what kind of treatment as well as the course of your treatment to be taken. Another myth which we commonly hear is that people tell the patients to just snap out of it and not to take medications. However, when you are suffering from a mental health disorder, just snapping out of it is not an option. Taking treatment along with your doctor as well as your lifestyle changes will help you get better. Another myth which we commonly hear is that psychiatric medications can cause a lot of side effects. So आपने या आपके पहचान वालों ने बताया होगा कि कभी उन्होंने ये मेडिसिन्स लिया और इस पर बहुत सारे साइड इफ़ेक्ट्स आए. I want to assure you that side effects are to any medication is very rare and some of the side effects can be easily dealt with. Most commonly the side effects which we see can be a bit of gastric upset यानी कि bloating feel करना या acidity या थोड़ा सा stomach upset. All of these can be easily managed with the over-the-counter medications. If you ever experience these side effects or if you know of somebody experiencing this, you can discuss with the doctor. They can help deal with these side effects with medications or with the change of medications. So till now we have seen some of the commonly available myths or misconceptions which we all have about psychiatric medications. I would like to go through this again. So most commonly which we hear is that psychiatric medications are addictive. Psychiatric medications once started have to be taken for life. Psychiatric medications are dependence causing. Psychiatric medications can cause a lot of side effects. Psychiatric medications can affect your kidney, your liver or other organs. They can change your personality or how you are. We also commonly see people scaring other people that once you start these medications, you will change and you will never be able to stop this again. This is my effort to clear some of the myths surrounding these psychiatric medications. Remember, if you or anybody you know is suffering from any mental health conditions, it's best to take help from a mental health professional. The doctor, you, or your therapist are the best person to decide the course of action for your health. If there are any more queries, please feel free to reach out.